age, tribe, creed, or color. And I would add, it has also exhibited that it does not even discriminate by your trade or your profession. Because we can see the fatalities that have occurred by reasons of infections and even death to our medical workers. So COVID-19 is not a respecter of persons or status. So that behoves on us as a people to ensure that the basic guidelines, which are the only source of protection we have now, are complied with, because it's for the good of self, your loved ones, your families, and the community at large. I now invite the Honorable Minister of Health, thereafter the Director General, Nigeria Center for Disease Control, and the National Coordinator to the PTF to present their updates. I thank you for listening.
Good afternoon, everybody. The chairman and members of the Presidential Task Force on COVID-19, National Coordinator, the Director General and Permanent Secretaries, ladies and gentlemen. In the past 24 hours, we have recorded 643 new confirmed cases of COVID-19, and this is out of a total national of 199,016 tests done, bringing us a total of 34,259 persons so far confirmed positive, of which 13,999 have been successfully treated and discharged. We have regrettably recorded 760 fatalities, mostly with comorbidities, and a total fatality rate of 2.21%. As the numbers continue to rise in this phase of community transmission, Nigeria, like most other countries, has hardly any other tool left than to focus on the value of non-pharmaceutical measures for prevention. Studies in many countries have confirmed the effectiveness of wearing masks in reducing the risk of COVID transmission, since it provides mutual protection to all wearers. It is therefore still important for us not to give up, but to continue to practice these measures, especially the use of face masks, physical distancing, and imbibing the social etiquettes like not sneezing or coughing into open space, but into a tissue, especially where people are around you. The stated aim, which I will repeat, of the Federal Ministry of Health once again, is to reduce fatalities by ensuring that those citizens defined as vulnerable to COVID-19 are offered protection by prioritizing them for advice on non-pharmaceutical measures like staying home, except for essential activities outside the home, and in such cases, wearing and retaining a mask and avoiding gatherings of persons. Going to places of worship should be if their condition, their physical condition permits, and their health condition, and the prescribed arrangements have been made, or else pray at home. The vulnerable will also be prioritized for admission to observation or treatment centers, even if they do not yet have symptoms. In this regard, it does not help for anyone to continue to deny the presence of COVID-19 in our communities or to test its virulence by engaging in risky behavior. The consequences can be dire. Countries around the world, including even the most liberal in Europe, are now making masks mandatory for people who use public transportation and even those going outdoors. And they are imposing a fine for non-compliance. We urge all shops, businesses, service centers, and places authorized to open to the public to require that their customers and visitors use masks or a face covering, or else be denied entry if they do not adhere to these simple measures. It is also important to state for clarity that masks should cover the mouth and the nose, and we shall get used to the inconvenience that it may cause some persons. A mask pushed under the chin is not effective. It should not be under the chin for any reason. Third, that we need the mask most when we are speaking, and it should therefore not be removed or lowered in order to speak. Fourthly, that wearing a face shield alone has not been proven by tests to offer the same protection as a mask, and should therefore either be combined with a mask or totally left to healthcare providers for whom they were actually intended. The COVID-19 pandemic underscores the fact of close relationship between national security and health. In my capacity as Minister of Health, I addressed participants of the 13th course of the Nigerian Institute of Security Studies on how prepared Nigeria was for the COVID-19 pandemic. It was well received, and the ensuing interaction was useful for mutual understanding. And among the facts shared was that Nigeria was recognized as one of the first globally to initiate COVID-19 response by activating very early a containment strategy, and on transition to community transmission, building up its national pandemic and influenza preparedness and response plan, a national strategic health development plan to develop a national COVID-19 response action plan. The collaboration among sectors of government and also with the governed is an essential prerequisite for tackling this virus. The impact of COVID-19 outbreak and the collaboration among ECOWAS nations, of which His Excellency President Muhammadu Buhari is the COVID-19 champion, was the subject of the second conference of ECOWAS health ministers who form the Ministerial Coordination Committee and held a meeting under the chairmanship of Nigeria's Minister of Health. It took place by conference 2 days ago, and the sub-regional strategies were reviewed and the need stressed to improve on the low level of testing and bed spaces, with a resolve to strengthen test, trace, and treatment strategy. It was also resolved to share ideas and also examine the modalities for improving travel and easing sub-regional travel. I shall close by, as usual, reminding all listeners that COVID-19 must not be trivialized and that all citizens must care for themselves, their families, and each other. There is plenty of room for socials. There is presently no room for socials and parties, let me remind you, and also for unnecessary travel. All these we have to wait until further notice. I thank you all for your attention.
Secretary to the Government of the Federation and Chair of the Presidential Task Force, Honorable Ministers, Permanent Secretary, gentlemen of the press. Today we'll spend a few minutes in reflecting on work that is evolving around research. The novel nature of the COVID-19 pandemic presents a lot of uncertainty, but also a great amount of opportunities for research. Currently, African countries, through the Africa Center for Disease Control, the West Africa Health Organization, the Africa Union, and WHO Afro are spearheading various initiatives against this new pandemic. This includes the Africa Task Force for the novel coronavirus called ACFOR, and the Africa Union Commission Consortium for COVID-19 Vaccine Clinical Trials. Collectively, we are developing our own research initiatives in Nigeria to inform prevention and control efforts. So, about a month ago, we launched a coordinating platform for COVID-19 research in Nigeria, known as the Nigeria COVID-19 Research Consortium. This is convened by NCDC and the Nigeria Institute for Medical Research, and in collaboration with the Nigeria Universities Commission and the TED Fund. NCRC aims to address broader research questions identified and our national priorities in line with the WHO research roadmap. So the NCRC is at the moment serving the purpose of collating, identifying material resources across the country that will be used to define some of these questions and answer some of these questions. The consortium is chaired by Professor Tunde Salako and myself. Professor Salako is the DG of NIMA. We chair this group together, and is currently made up of 42 scientists and experts from 32 Nigerian institutions, including research institutions in NIMA, NIPRID, NVRI, that's the Nigeria Veterinary Research Institute, IHV, and many universities and centers in many ministries across the country. This is just to show you the extent of collaboration we are trying to achieve. Now, the technical arm of this consortium now comprises of 10 working groups addressing key thematic areas. So we've identified working groups for every thematic area. One example of the work that we are beginning to do is the validation of test kits to ensure that standards are met. So following a recent call, we got 120 expressions of interest from across the country. So rather than do this in an ad hoc way, we asked for everyone that has an RDT interested in validation to provide an application. Following vigorous screening, 25 initial EOIs, expressions of interest, were selected to submit a full proposal, out of which 18 are currently undergoing review. That's just an example. There's a working group on diagnostic kits, and that's the process that we're going through collaboratively. You will remember that we also, with ACEKID and NIMA, sent the first full genome to the international stockpile, international collection, and we've just sent a second set of sequences to the global collaboration that will then define how this will be used for vaccine development. So, in addition, another working group is working on social science to understand what is driving transmission in different parts of the country. So this is just to share an example of what's going on the research side. NCRC is working hard as part of regional and global efforts to finding solutions to various parts of the challenge we face. Research, by definition, requires a very high level of commitment. It requires patience and perseverance, and all members of the consortium are working very hard together to meet up with the demands that this new virus presents. Research is definitely a priority for us. If there's one lesson that we must learn out of this, is to inspire a whole new generation of scientists to help us drive and look for solutions to the problems that we face. Thank you.
The chairman of the Presidential Task Force, honorable ministers, members of the PTF, permanent secretaries, heads of parastatals, gentlemen of the press, good evening. As a follow-up to last Monday, when we made a very strong recommendation that all those above the age of 60 years remain at home and keep away from social contacts as much as possible. Today I will be giving you additional details with regards to people that are vulnerable or in high-risk groups. As we know, COVID-19 infects people of all ages. However, the evidence to date suggests that two groups of people are at high risk of fatal illness from COVID-19. These are people above the age of 60 years and those that have underlying medical conditions, such as diabetes, cardiovascular disease, chronic respiratory disease, cancer, or anything that suppresses your immune system. It is therefore very important that those persons that fall within this group know how to protect themselves from COVID-19. However, even if you are not at high risk, we must continue to play our part to prevent the spread of coronavirus to those who are vulnerable and can die from COVID-19. The risk of mortality here in Nigeria, on average, those above the age of 60, up to 18% of them could die from COVID infection. And we also know that younger people have died. Here in Abuja, the youngest person to die from COVID was just 38 years old. So we are all at risk. But how do we protect ourselves, and particularly if we fall within the vulnerable or high-risk groups? Well, first of all, if we are on medication, ensure that you take your drugs diligently. If you're diabetic, make sure that your diabetes is under control. If it isn't, we strongly suggest you see your doctor. If you are due for any vaccinations, make sure your vaccines are up to date. Medications, it's important to keep your medications at home and a sufficient quantity, and to limit trips outside your home. When we talk about staying at home, it's not about staying at home and hosting a lot of people, guests, relatives, etc. No. By staying at home, you are limiting your social interaction. You limit your home visitors to only essential people, who in turn must observe all non-pharmaceutical prevention measures. It's also important to keep up to date with our health advisories from the NCDC, ourselves, the PTF, as well as WHO and other international bodies. If you are within this age group and you have to go out, and it's essential you go out, then please wear a mask over your nose and mouth, just like I'm wearing at the moment. Do not expose your nose We have seen so many pictures of people speaking publicly and pulling down their mask, or people not wearing their mask, just using their mask to cover their beard or chin. So now is not the time to demonstrate how handsome you are. We've got to get through this particular period without showing our faces. So apart from wearing masks, it's important to maintain physical distancing. The more you maintain physical distance, the less likely you are that droplets of infected material will land on your face or in your eyes or on your mouth. And certainly do not engage with anyone who is not wearing his mask properly. If you wear a mask, you are actually protecting more of the person you are contacting, you're talking to, than yourself, because you're stopping excretions from going out. So in a way, it's a good way of showing your concern and your love for the persons that you are coming in contact with. And it's all about responsibility. So pay attention to the changes in your health, of course, and report any symptoms you see or observe, like fever, cough, or difficulty in breathing, to your doctor. We must all take responsibility, as actions or carelessness can fatally affect the people around us. We must all continue to practice non-pharmaceutical interventions, and if you do notice any COVID-like symptoms, please avoid close contact with others, but especially those that are at risk of severe infections, such as our elderly friends and relatives and those with pre-existing conditions. It is preferable that you postpone every form of social gathering unless it is essential with this vulnerable group of people. We are all now COVID-19 frontline fighters, and it is this fight that will keep us, our elderly loved ones, and all those at high risk of fatal disease safe and alive. Thank you.
Gentlemen of the press, or of the media as I call you always. Well, there has been the questions that were sent to us, so we use this platform to make explanation as what is going on. We did say that all airports in Nigeria are open to domestic operations from 15th. It remains so. They're all opened. However, we are at a liberty to open and close airports depending upon so many other operation reasons. At any point in time, whether there's COVID or no COVID, we can close or open an airport. Unfortunately, we are living in a country where everything is, it's so polarized that everything is trivialized. I remember we received lots of pressure and questions regarding why can't we open at least one airport in each geopolitical zone, and pressure to open Owerri. We did open Owerri because we believe Owerri was good to open, not because of any consideration whatsoever. If Owerri wasn't ready to open, we wouldn't open Owerri. Now we're receiving also from Sokoto pressure. If we find out that we can't open for one reason or another, we will not open. It's all safety. Now, having opened for domestic operations, I like to say that Murtala Mohammed International Airport, Nnamdi Azikiwe International Airport, Port Harcourt International Airport, Malamini Kano International Airport Kano, Sam Mbakwe Airport on Owerri, and the Maiduguri Airport and the Uyo Airport are open and they're running. Yola and Kaduna, we expect to open tonight. This is because once we said they're open, we now went back into those airports to ensure everything is okay and safe to operate, health-wise and operational-wise. And some of these airports are so far apart, and security reasons and difficulty in travel We are lucky that we have an aircraft at our disposal which is meant to be for calibrating our equipment. We use that aircraft to enter into all of these airports to ensure they are safe. So Calabar is inspected, ready to use. We have a challenge on none of the security equipment. Once that is dealt with, we open Calabar as well. Sokoto, Katsina, and Kebbi, we'll inspect them on the 17th of July, which is tomorrow, on Friday, and then we open them. Benin, Akure, Ilorin, and Ibadan. They are not ready for the inspection until 20th July, and this is according to the airport managers who are localized there. So on 20th July, we get into these airports, ensure we do the needful, and also open them. Makodi is scheduled for Saturday, and we try to pair it with Jos to inspect. And then some of those that were awaiting them to send in their plan for restart, and these are not airports, some are not airports owned by federal government, like Bauchi, Gombe, Asaba, Escravos are not government owned. However, Duse and Usubi are federal government owned, and we will wait until when they tell us they are ready, and then we go and inspect and we open them. So please note that you can wake up tomorrow and we will close Abuja if we have a need to do so. It is not any consideration of geographical spread or federal character, no. So much with that. And then the next thorny issue also, the ministry and agencies have received lots of inquiry regarding some alleged unruly passengers. And I think one of the agencies, FAN in particular, had tweeted, and because of that we received a lot of questions. So FAN had escalated what has transpired. These alleged unruly passengers included the former governor of Zamfara State, Abdulaziz Yari, whom I spoke to yesterday at length, the current governor of Adamawa, Amadou Fintiri. By the way, that of Abdulaziz was on Saturday in Kano, and that of Fintiri is in Port Harcourt. And then Chief Nduka Agbamina, also alleged here in Abuja. Now, those are being investigated, and if it found that it was true, we will do the needful. If it is found untrue, we would definitely apologize to these individuals. However, I'd like to go through the Nigeria Civil Aviation regulations. There is a definition of an unruly passenger. On this platform, I said that there are unruly passengers and we have a protocol and way to deal with them. It goes to say in part 1797(1), any passenger who becomes unruly at the airport terminal building or on board a particular aircraft commits an offense. So first, it is an offense. Then, part 1797(2) further defines the word unruly. In this section refers to, and is not limited to, the following. I'll just choose two out of the many. C, fighting or other disorderly conduct on board of an aircraft or in the terminal building, which means in the vicinity of an airport or inside an aircraft. Then the E part, unruly behavior means, according to E part, disobedience of lawful instructions issued by the aircraft commander, which is the captain, or flight crew, that means any pilot or flight engineer, cabin crew, cabin attendants, check-in staff, and or security screening staff, or any lawful staff on lawful duty at the airport. So if you refuse their instructions, you have become an unruly passenger. An unruly passenger, according to table 2.9 in bracket 51, unruly passenger behavior requires the punishment of criminal referral for imprisonment for not less than 2 months. So it can be 10 years. So the regulation says of not less than 2 months. It can be 10 years. So if you are found to be an unruly passenger, because you are a big man, VIP, the simplest that we could do, the easiest, simplest thing that we could do is to refer you to the police, and they must, by law, prosecute you regardless, and it will be not less than 2 months. And I'm sure you wouldn't want to be a criminal for 1 day, even for 1 second. No one wants to be a criminal for 1 second. Ladies and gentlemen, please, VIPs, please, show that you are a VIP by conducting yourself in the manner that you would want to be identified with. If you are found and you are caught, we have some videos on these unruly passengers. We will investigate. And the punishment will be not less than 2 months of being criminally liable by a court of law. We mean business. We're very serious about this. Unfortunately, I said to myself the other day, why me? Because 2 weeks, when I became minister, 2 weeks in 2015, some unruly passengers crashed the protocol, went to the air side, and prevented Turkish Air from flying. I removed the airport terminal manager at that time and did quite a number of changes, issued some queries, and so on and so forth. That's just 2 weeks when I become, and we cannot afford that. The security implication, the health implication. By the way, airports are national security assets. They're the only borders that are borderless. They're the only borders that are borderless. Like we keep saying, 1 mile long road leads nowhere. 1 mile long runway leads to everywhere. So these are borderless points. We take them very seriously. The weight of responsibility on keeping airports safe, either by health protocols or by our own security, it's definitely enormous. We're equal to the task. We will not allow it. Whoever is involved, and we'll deal with it. Certainly, we are equipped with cameras in our airports. We can pick everybody. And I know also all security agencies in this country have cameras in the airports. We will take it very seriously. We will investigate. And once we find you guilty, we will prosecute you. Thank you very much.
Thank you very much, Honorable Minister Aviation. Chairman, Presidential Task Force, I'm receiving a very interesting signal from this side. Our colleagues appear to be very satisfied with your remarks. You still want to ask the questions? Because I understand they want to go back for production, and but okay. So the lady in red wants to ask a question. Our colleague is up here. Okay, you can come up to the microphone.
The Chairman, National Coordinator, members of the PTF, my colleagues. My name is Amaka Ude. I report for Arise News, and all of my questions today about the management of COVID-19. And I want to start with the DG of the NCDC. Well, the last time you had told us that the virus is only viable in your body only after 10 days. Yes, you said after 10 days, even if the person doesn't test negative, you can let them go home, especially if they're asymptomatic. The reason why I'm bringing this up, I've received a lot of complaints as to the duration between when the samples are collected and when people get their results back. For instance, there was an incident today. I went to the Gariki Hospital here in Abuja, and there was a young man who had been tested about 3 weeks ago. He just got his result today that he is positive. But this is a person who has no symptoms whatsoever, and now he's been asked to go to the isolation center. But he's refusing. He says, I have no symptoms. So in this kind of situation, what would you suggest? Would you say this person should go and run another test or should be forced into isolation? I would need your update on that. And my next question is for the Minister of Health. Well, it's still like it has to do with the management of those who are presumed, even if they've not had their test done. Some patients go to the hospital showing some symptoms of COVID-19. But some of the hospitals are not accredited to treat or even test COVID patients. But these doctors are faced with a situation where they have these people, some of them even dying in their hands, but they really cannot treat. In such a situation, what should they do between when the samples are collected and when eventually the results of these patients come out, especially for those who are diabetic or have other underlying illnesses? This is really key here. And also there are complaints from the frontline workers that the hazard allowance that was promised to them here by the Presidential Task Force, that nothing has been received 5 months since we started managing this pandemic in the country. So we need to get an update concerning the hazard allowance as well as the insurance that was promised our frontline workers here in Nigeria. And finally, to the chairman of the task force. Well, this has got to do with some people who are in the business of importing medical consumables. Yes, we know we're trying to push for homegrown solutions to COVID-19 and getting all the sanitizers and all that we use to manage the virus. But some people who import the raw materials, they are being asked to pay for something called facility inspection. And these prices, some of them are complaining, they are quite high. And after that, that is when they can even go get the NAFDAC numbers. So they are asking if the PTF, okay, you can direct it to anybody else, if the PTF can intervene, because these are things that we need in the country. Like it or not, Nigeria cannot produce enough to take care of us as it stands right now. Maybe in the future, but for now, we need as much help as we can get. Thank you.
Good evening, sirs. Rachel Abuja from the News Agency of Nigeria. My first question is for the Minister of Health. Sir, how true is this report of 58 medical doctors who were earlier stopped by the Nigerian immigration for going abroad? We heard that they've left the country through Benin Republic. And most Honorable Minister, what can the country do to derive a maximum benefit from the investment in training of doctors, which is usually subsidized or entirely on scholarship? And also, what is the strategy to tame this exodus, especially in a time like this during this outbreak, so that we won't have to lose our doctors to the outside world? My next question is to the DG NCDC. Sir, you made mention of research going on in Nigeria. What about how is Nigeria working to ensure effective collaboration with the international world or the global world? My last question is for the Minister of Environment. So far, sir, the virus is said to be airborne, even though we are still working on it. But from evidence keeps evolving, and we are still hoping. I would like to know if we have any framework in place, let's say like environmental policy framework that we should be looking at for now. Thank you very much.
Thank you very much, it looks like the inspiration came back and the questions came up. We will be taking responses from the Honorable Minister of Health, the DG NCDC, the Honorable Minister of Environment, and finally, the Chairman will round it up. So we begin with the Honorable Minister of Health.
Well, thank you. I think it was Amaka who asked that question about what to do about patients who come into a hospital. Now, if you recall, most of the statements we issue here, and I said it again today, that those who are vulnerable, who have a certain age and above, if they start feeling any sign, they should go early to the hospital. And that the priority be given to those who are diagnosed and they have underlying conditions, they need to be admitted so that if complications arise, they can be attended to early while they are in the hospital. So when people are arriving late and in emergency like that, usually there's been a delay somewhere. And I think it is also possible for me to pass it back over to you in the media to make it clear that those who have symptoms, who have been diagnosed positive, should present themselves. It is not a question for the doctor or hospital alone. So if you help to amplify that, emphasize, so that we face none of these situations that you described if the patient presented at the right time. And we give priority to those who have precondition. You can say, yes, you are diabetic, you are obese, you have a kidney transplant, and you are positive, therefore you are coming to admission, you immediately be admitted. But if you wait at home and then symptoms begin to appear, as I said earlier, they can appear suddenly and they can aggravate very, very suddenly too within a short time. And then you run to a hospital which is not accredited for treatment. You've gone to even the wrong place. You didn't even prepare where you should go, which is not also correct. Then there's a problem on all sides. Now, so you put the doctor in a difficult situation because he's not accredited to treat, and you have put him in a difficult situation. He has to try and do the measures. What we say now is find a holding room. We have urged all hospitals to have what we call a holding room, where you can have patients who are positive or who have symptoms and might be positive, and then call for transportation for help. We are developing an ambulance system now, which was used in Kano, and it's still functioning there. You call an ambulance system that comes to pick up your patient if you are not accredited. Particularly, this happens particularly, I think, often at night. And those are very, very difficult times for a doctor to come out. So for the doctors themselves, we urge all of them to have, those who have sample collection sites, who are now sample collection sites, are also to have a holding room where patients will be held, will be kept, or rather held or looked after till an ambulance picks them up. So and then of course they must immediately be given a mask to wear so that they are not infectious to people. And all hospitals should also by now have, at least in reserve, personal protective equipment which will be used in those such circumstances. So we want to have less and less of the situation that you described, fewer, because we want early appearance. So, and so that if you appear in a hospital which is accredited, definitely you have no problem at all. But even then, the doctors will not be happy that you waited till last minute. And we do see a lot of doctors who complain bitterly that people come at the very last minute when they are gasping and they can't breathe anymore, and everybody else will start scrambling. Sometimes there's not even a bed, and that's why I gave the order that even such patients should not be rejected, even if you are going to put them on a couch or on a stretcher or even on a mattress and give them oxygen. Do that to save their life before you start to ask any further question or to blame them for anything. So, with regard to the frontline workers, we said last time that if anyone who feels they have not been paid their allowance or given their, or they have not received their insurance, they should report to the Ministry of Health. They should speak to Director of Hospital Services, or can even register in my office, or with Minister of State, or with Permanent Secretary, or write a letter and to be attended to. We are not aware of that. Somehow or the other, if they prefer to contact the press, instead of contacting those who are responsible, it creates a longer way to solve that problem. So the allowances have all been worked out, and if you haven't received yours, you go through the correct channels to address that problem. Now, with regard to the 58 doctors who left, we were all surprised to hear that they were at the airport. I think somehow or the other it was irregular in that many of them did not have visa. Now, I don't know what evidence you have. Maybe it's a rumor that they have now left the country. I don't know, but nobody should be leaving the country without a visa. Everybody should be living normally. And we also believe that, I think you asked a question about those who were trained by scholarship or by a state expense. Was that your question about how we trade at state expense and how to retain them? Yes. Now, retaining doctors under these conditions is a bit difficult. Those who have been trained with scholarship or whose training was subsidized actually, and they are on a job. They are on a job here, actually have a moral responsibility to give back. Because even now we have large numbers of Nigerian doctors in the UK, in the United States, in Europe, who apply to come every year to come and serve, even though they were not even trained here or they were not even trained at state expense. They have the obligation to come and give back to their community. It's just a moral obligation. So every year it is called the Diaspora Health Professionals Initiative that they arrange. Some of them spend their own money and come here. They bring equipment, they bring materials, they bring commodities. Every year they come and help us. Although they really owe the country nothing, but out of a sense of obligation, which is very good, very commendable. And we're in fact trying to improve on that initiative now and to see that we get the best out of the experience and the cutting-edge knowledge and skills that they bring from abroad. So even more so, those who are here and you have been trained, you try and you have a job, it's better to also give back to your community. And others who want to live where Nigeria does not have a policy of restricting movements, but some countries do. Some countries do have that policy, but we don't, except to appeal that those who have been trained at state expense should also give back to their communities. We are trying to make sure that the remuneration is good. I think we are one of the few countries that are actually giving this hazard allowance. Now, this UK where they are going to, there's no hazard allowance. They don't give doctors hazard allowance. You just get your salary. That's all. And because I've spoken to doctors there, and they said it's part of your job. That's what you're trained for. And they don't pay you anything. But here, apart from a salary, the state tries to add something to it in hope that we are going to attract our people to stay. We're also urging state governments to prioritize employment of doctors, to employ the doctors, some of them who quite truly have not been employed. So if we're able to absorb them in private hospitals, state-owned hospitals, and local government hospitals, to mobilize funds, to give them something to do in their training, that will also help in retention. But in rebuilding the entire health system, part of it will be a strategy to increase and improve the workforce, which we are working on, a strategy that will increase the demand and doctors and retention and the conditions of service, which hopefully will reduce this attrition of doctors going abroad. But I also inquired with people I know in the UK, and they said even the UK itself, they're also losing doctors to other countries, so they think that there is a movement like that. But I think that we have to look after our own case, our own situation, the best way we can.
So thank you, Amaka. I think your question was on delays in getting results. I think first thing to say is, for the gentleman in question, there was really no need to bring him into care, especially since there was such a long delay from when his sample was collected. If you are asymptomatic, after 14 days, there's really no need to bring you into care. You'll be fine at that point. You know, in whatever you do, where there are numbers, there are always outliers. We've done now close to over 200,000 tests across the country. And by far, most people get their results on time. We now have testing facilities in 54 centers in 30 of our 36 plus 1 states. One day we'll write about that. It's been a small miracle in getting that level of distribution of a very complex architecture across the country. And we continue to work very hard to make sure that we cover the 37 states in Nigeria to bring testing as proximal as possible to people, and therefore also reduce the time, improve the timeliness in their getting results. The major factor actually driving the delay is not in the testing, it's in the process from getting the result of the lab to the individual. And we've thought of various models. We don't want to bypass the states because the states are really the custodians of the public health response. And if we do that for this disease, it will be hard to then define when to stop. But what we're trying to do is now use technology. Last week I mentioned that we've been working on a new platform through which people will be able to check their results themselves, actually. And that platform is nearly ready, and that will really provide a solution, at least for people to get the results of tests that they have had. There are very few reasons in any lab where that delay could have been possible. There are things do happen. In Ebonyi last week, we've had to shut down the lab for a few days because to decontaminate the lab, and it's just restarted. So there are unique circumstances where testing is delayed in one setting because of an event, but it's very unlikely that any lab that is working can lead to a delay of 3 weeks. So there must be something specific that happened in that case. So, but I do think we will continue improving over time, and we've improved a lot, and we'll keep working hard at it to make sure every Nigerian has a better impression and better experience of the work going on across the country. On Rachel's question on how we're working globally, you know, when you say how is Nigeria collaborating, and Nigeria as a country doesn't collaborate in terms of research. Individual organizations do so. And we have said here severally how we work with the Africa Center for Disease Control, the World Health Organization, and those organizations that have a similar mandate to ours to make sure that research and public health response is done collaboratively. And many other universities in the country have very strong relationships with partners globally. The most important opportunity we would have had now in terms of carrying out clinical trials, we're not there yet, but this is something that has been highlighted as a deficit, and we have to build up to it. Carrying out clinical trials is a very complex set of activities because what it means is that you're basically giving people a substance that could become a vaccine. But at that point, you don't know if it works or not. So you not only have to have the ability to organize the trial, you also have to have the clinical ability to respond to any harmful side effects that could happen. So we have identified quite a number of opportunities, and that's why we've come together in this consortium so that we can work together in the long term. Research is a very slow, deliberate, and very difficult set of activities. So it does require people that are committed to research, not just because there's a new disease and they come in. So we'll continue working hard on that, recognizing that more than ever, this is a global pandemic and none of us will have the answers on our own. So thank you very much.
Chairman, distinguished members of PTF, ladies and gentlemen of the press, good evening. The question is whether we have national air pollution control as with regard to the coronavirus. A framework. Okay, well, at this point, let me say it's most likely too soon to talk about framework for air pollution control as regard to corona. Now, air pollution in general is anything in the air that can be harmful to us. And the coronavirus, as we know, it's really not that much airborne, which is why the 2 meters or more, the heavy droplet will fall. But research, as he has just mentioned, the DG, being a novel virus, every day we're finding something new. Research has shown that sometimes the very micro droplets, which you can say aerosol, can remain in the air for some time, but it's not really an airborne disease per se. So this mask that we're wearing, you can consider it some kind of, like in industry, we have smokestacks that will catch emissions. This one will catch the exhalation of the droplet, and of course, possibly if they are to be aerosol, they will not because they are being trapped. So it is an air pollutant in that respect when it's in the air. But as far as national policy framework at this point is too early. As research is going on, we'll also be looking at that. What other policies or framework can be put in place as far as coronavirus is concerned and the contamination of the air we breathe. So basically, right now, there is no national policy on that. Yes, yeah, we are. That's what I'm saying, that since we are researching new, every day we are getting new information. Based on that, we are changing some of the things that were, for example, from the beginning, everybody was talking about ventilators. Today is oxygen concentrators. So the same thing. Now we are looking at everything. If we find any reason to look at some framework on that, as time goes on, we will do that. Because every day we are researching, we are getting information from across the world. It's exchange of information. And then you go further as to what to do next to respond to the new information. Okay, good?
Thank you. Let me now invite the chairman of the PTF to the podium to sum it up.
There are no questions left for me. All have been answered. Amaka, I think your question has been answered by the minister. What was it? Pardon? Okay. Manufacturers. I believe our manufacturers are being well taken care of. That's the truth about it. There's a whole package of about 100 billion provided by the central bank, which they can access. And I know a lot have accessed it. As a matter of fact, if I had access to my phone now, I would have even read out the names of companies that I know, because I did make inquiries in respect of that. Some pharmaceutical companies that had sent in their applications through their banks. And normally, your bank will process it for consideration of the central bank. And it is the central bank that will look at your application based on their information that is provided by your bankers that would now enable them to take a considered decision as to whether you can access those funds or not. But I can tell you that a lot of pharmaceutical companies have been accessing those funds. And I believe that It is all in an attempt for us as a country to restructure our manufacturing sector, particularly with regards to pharmaceutical products. We have basically been a consuming nation when it comes to pharmaceuticals. Most of the drugs you find in our pharmaceutical shops or in the pharmacies are imported drugs. And I believe that those drugs can be patented and also manufactured in this country. All we need to do is to put a framework that would encourage our pharmaceutical firms to begin to produce these drugs here. And the central bank is doing a lot in that. It was one of the major first interventions that the central bank put in place. 100 billion for major hospitals and pharmaceutical companies to access. So I don't know the difficulties being experienced by the case in point, but you can refer them back to the central bank or to their bankers first, because the central bank does not operate except there has been a reference from a company's bank to the central bank after they have evaluated the application and have seen the desire and the necessity for them to be able to access the stimulus that has been provided for by the central bank. We are talking about billions of naira and trillions of naira that have been put together. One of the basic problems that I know most entrepreneurs in Nigeria are experiencing is the question of proper documentation and articulation of their requests. This is an area that we will have to improve on. There are a lot of people that are supposed to access even the small home holder loans. If you can just prove to your bankers that your business, your small or macro business has been negatively impacted by COVID-19, you'll be able to access per household something as bare as 500,000, 3 million. But a lot of people whose businesses have been negatively impacted will not even take the trouble of accessing these funds. And the funds will be lying there in the central bank, unutilized. So my appeal to our entrepreneurs, particularly the medium, small, and macro businesses, there is a lot of packages that have been provided for. They should take the pains of accessing the website of the central bank and getting the necessary information that will enable them apply through either their banks or for the small household facilities through the microfinance bank, National Microfinance Bank that has been established for that purpose. I believe if they do that, we will be able to turn around the fortunes of their businesses and their companies. And for the major pharmaceutical companies, approach your bankers, and by extension, make sure that you have proper documentations of what you want to do with the money. It's not free money. It's not going to be thrown. You have to account for it. You have to pay back the loan with the minimal interest that it attracts. I think right now where we are in our national response is very, very important. And you can see from the appeal that I've made today, especially to our leaders and to our followers, is for each and every one of us to be resolute in taking personal responsibilities as to our conduct and our actions. Because whatever you do in this particular time and the regime of the response would adversely affect other people. And my prayer is that as we count the days and we see the figures rising, our perception of the risk should change drastically. By yesterday night, we recorded 760. The figures are not likely to be abated in terms of their growth. They will continue to increase in number. Last week, we had the highest fatalities of over 76, or about 76 in a week. So it means that these numbers will keep increasing. And we have said it here severally, that the impact of the figures that account for cases now will begin to reflect 3 weeks, 2 weeks, 3 weeks down the road. And I do not want us as a nation to get into a panic mood. It is expected. We have not peaked yet. We are likely to peak by the modeling, sometimes around September. And if we can just do what is needful in terms of complying with the non-pharmaceutical measures that have been put in place, we will drastically be able to reduce the rate of community transmission, because that's where we are now. There's nothing you can do about it. Out of experiences, you know that as much as I do, that each and every one of us has a duty to take personal responsibility. Even as we congregate in this hall every day, now Mondays and Thursdays, it behoves on each and every one of us to take personal responsibility as to how you relate even with your colleagues, how you mingle, the things that you are not expected to do consistently. You can't just pretend that because they are your colleagues, you remove your mask and lower your guard when you are talking to them, or because they are family, or because they are friends. The choice is really ours, and we must make the right choice in how we respond to this pandemic. But I'm very confident with the resilient spirit of Nigerians, we will overcome and we will come out much stronger. Thank you and good evening.
Thank you very much, Chairman PTF. That brings us to the end of the national briefing for today. But before we go, a quick reminder, the process that we started just before the national briefing commenced will continue upstairs. So please make yourselves available to be part of that process. And Nigerians, in case you missed any part of this national briefing, this is just a quick reminder for take-home today. As the global African and Nigerian numbers keep rising, they point us in one direction, that we must take responsibility. We must not give up. We must change our behavior. We must observe all the measures that have been put in place to save lives. Two is that there's an opportunity for economic and industrial growth. Demand has obviously stimulated manufacturing and other forms of production of critical items. But we must be wary of turning in fake products or substandard products that can in turn jeopardize the lives of fellow Nigerians, innocent consumers at that. Three is that in every one of us, there's a leadership trait. Depending on the circumstance, you could be a leader, you could be a follower. Whatever point you find yourself, please be a good one. Show very good example at all times, especially for those who look up to you, and help Nigeria to overcome this problem that we're in terms of the pandemic. Finally, government has provided a lot of packages to keep businesses afloat. Take your time to develop your business plan and articulate your request to meet the requirements. There is an opportunity for all businesses to get back on their feet, keep employment going, keep the economy rolling forward. I thank you very much. God bless Nigeria. We hope to see you on Monday by the grace of God. Thank you.
To know by simply clicking on any of the links on the sidebar for headlines, domestic and foreign news, economy, security, politics, sports, and more. Stream live on your smartphone and tablets and stay connected. It's pretty easy. Simply download NTA News app from your Google Play Store and you're good to go. NTA News mobile app, your access to real-time information.
Coronavirus is real. Steps to avoid this pandemic. Wash your hands regularly or sanitize your hands. Keep social and physical distancing. Avoid crowded places. Stay at home unless absolutely necessary. Don't touch your eyes,